Well, one of the most common cancers among men is prostate cancer, and September is Prostate Cancer Awareness Month. And while it can be serious, early detection and advances in medical treatment really have improved outcomes for patients. Here with me this morning now to talk about what men and their families need to know when it comes to prostate cancer is Dr. Michael Degon, a urologist with Novant Health. Thank you for being here this morning.
Sure.
You said it's very common. How common is it really?
Well, it's going to be the most common cancer that men are going to face of all them. It affects about 1 in 8 men. It will be diagnosed with prostate cancer in their lives.
And so there are some symptoms in most cases. Can you describe what some of them are?
The symptoms that can happen, and this was probably back in the 1980s before we had good screening protocols, is men would present with back pain or retractable blood in their urine. And that was actually a sign of locally invasive prostate cancer or metastatic prostate cancer. So now we try to identify it earlier, much earlier.
Heredity, an issue in this, and how early should men start to be screened?
Sure. Hereditary genes definitely play a part in it.
Okay.
So if you have a family history, men in your family have prostate cancer, you are at an increased risk. If you are African American ancestry, you're more likely to have higher risk cancer. So those reasons we start screening a little bit earlier. So for average risk men, recommended screening is between age 45 and 50.
Okay.
And higher risk men age 40 to 45.
That may surprise some people watching television that it's a little earlier than they would normally think. You would think that this would be something that would impact an older population.
Yes.
Treatment changing dramatically, huh?
Yes, it has over the years.
In what way?
Treatment is largely divided into surgery and radiation if we're going to pursue treatment. Surgery has migrated over the last decade and a half to primarily robotic surgery.
Okay.
It used to be we do open surgery. For radiation, they have fine-tuned the beams. They really can focus right down on the prostate. We even have to put aiming beams for them to aim for because the prostate moves slightly as they breathe. So to focus their beams correctly, we give them aiming targets.
And for people watching television this morning, the one takeaway that you want them to remember is what?
It's important to get screened because the symptoms I mentioned really don't happen that much anymore because we diagnose about 10 years before you would normally present with symptoms. So making sure you're screening at the age screening, start with your primary care, age 40 to 45 if you're high risk, 45 to 50 if you're average risk.
All right, Michael Degon, thank you very much, doctor. We appreciate it.